They went in there and burned out the cancer.
Jeff Cardinal's prostate cancer was treated with a newer method called HIFU.
It stands for high-frequency ultrasound of the prostate.
Dr. Christopher Waite is Center Director for Urologic Oncology at Cleveland Clinic.
What it means is you take ultrasound waves. These waves are very benign. They can go through the body and not cause any trouble and give us really good images. But if you take all of those waves and you focus them in one single point, then they can develop a lot of energy at that very fine point, maybe a millimeter by 2 millimeters. And it's a little bit like a magnifying glass. You know, if you're out in the sun, it feels nice and warm and it's not a problem. But if you get a magnifying glass and focus all those rays into one spot, it gets really hot. And you can focus that energy in a very, very small spot, and then you can be a little bit more focused in the treatment rather than treating the entire gland as we have done historically for prostate cancer.
HIFU has less recovery time than traditional prostate surgery.
I woke up Monday afternoon in recovery. I didn't remember a thing, didn't feel a thing. I had no pain. They sent me home Monday night. I slept all Monday. I slept all Tuesday. Wednesday at home, I sat at my computer on my desk and worked. Did the same thing Thursday. Then Friday, I went down to the clinic. They removed the catheter. It was a little uncomfortable, but not really bad. I rested the most the first 2 weeks, but I was really back to my normal activity 3-4 weeks later.
HIFU is not for every patient.
The ideal candidate really is the patient who has intermediate risk prostate cancer. So has a real prostate cancer that needs to be treated. We're not really using it as a replacement for those who should be safely watched. And we're not really using it in really advanced cancers as well, or multifocal cancers as we talked before. So really it's kind of the intermediate risk patient who still has a lot of life expectancy before them, who has a tumor that's either in one side or two tumors but are on the same side and can be easily treated within the same treatment map, and has a good functional quality of life and wants to maintain that.
I don't have any urinary issues. I don't get chained to a bathroom. I don't wake up in the middle of the night having to go to the bathroom 5 times. I don't have to wear a urine bag. I don't wear a diaper. And my hardware works fine. My girlfriend and I are still intimate, and these are all wonderful things. I've always been a man of strong faith, and I always will be. And I believe in the power of prayer, and I know that I am blessed.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.